are some of the key game changers based on everything we talked about today and everything that you know about the hypertension guidelines and these statements? What are, I normally try to nail it down to one, but I feel like we have a few key game changers here. So what would you want to summarize our discussion with today?
Yeah, absolutely. I mean, we talked about these guidelines for a long time because there's just a lot to talk
Yes,
about. So,
yes.
the key game changers, the key things, if you're a pharmacist, to really, really remember, start screening early. And when I say start screening early, don't just think about blood pressure numbers. Think about the all the other things: thyroid
Mhm.
conditions, renal disease, BMI, so obesity, obstructive sleep apnea, primary aldosteronism. Like really think about early screening for secondary causes of hypertension and for comorbidities that might contribute to cardiovascular risk. And then once you do that screening, in the very beginning, I talked about how multidisciplinary approaches to medication therapy management and to patient outcomes are of high importance to me. So if you're someone who practices in the community, if you're somebody who practices in the hospital, it doesn't matter. You're a pharmacist that can connect patients with other providers, with specialists. Pharmacists are the number one trusted profession in the United States. I hope that still holds true. And we're the most accessible profession in the United States. So you are the first person, the patient will typically talk to about their conditions. So definitely have that discussion with patients about referring to a specialist if you believe more has to happen for screening purposes. And then the other game changer that I think is a really important takeaway is the actual blood pressure cutoffs. Screening for blood pressure. Remember that if you're at stage one hypertension, now the recommendations are to use the Prevent CVD calculator on the American Heart Association website. And then if you have stage two hypertension, really consider starting two medications at once, and if possible, use a single pill combo to help with that. Again, going away from race-based recommendations, just kind of focusing on the comorbidities and on what patients want. Talk to the patients, see
Yeah.
what medications make most sense to them, based on side effects, benefits, and things like that. Um, and then follow-up is really important. We talked about inertia. We talked about problems with titrating therapy. Adding combination therapy, adding medications on is of greater benefit than titrating medications themselves. So when you have somebody with high blood pressure and you think that they need more reduction, add on a medication instead of titrating that first medication. If the blood pressure is still uncontrolled on two medications, you can consider adding a third one and then titrating to target doses. Because when you have more medications on board with complementary mechanisms, that benefit in blood pressure reduction will be greater.